8 years, and it seems like I cannot avoid looking at this. As much as I try to look at all these other things, I always come back to the fact that I have to look at the foods that people are eating and the environment that they live in, because it directly impacts their health and their illness. So hopefully after this is done, you guys will get a sense of how to evaluate someone from that standpoint. Oops, let me see if I can go ahead and move this along. I'm not being able to advance the slide presentation.
Let me give her back to you real quick. There you go. Sorry about that.
Okay, it seems like when I hit my arrow to move forward, it doesn't seem to want to do anything, so I'm not sure why it's not advancing.
I'll advance the slide for you. How about that?
Okay.
There we go.
I'm happy to do it if I knew how to.
Oh, there you go.
Maybe that's it. Okay, there we go. So the objectives, you want to understand historical basis of food allergies and illness. I'll give you a little bit of history of what I learned when I belonged to the American Academy of Environmental Medicine and went to their conference there. Common signs and symptoms to look for, diagnostic evaluation of food allergies, food intolerances, and other environmental exposures that might be causing some cascading inflammatory reaction in the body. Integrative therapies to manage and treat allergies and lower future risk of disease, and understanding how the GI tract, gastrointestinal tract, can play a role in making things worse and can make things better too, and how to restore it using the 4R program. Okay, historical perspective. I found it very interesting, and I always do find it very interesting, how we kind of begun to understand the connection between our environment and ourselves. And Dr. Theron Randolph, who was originally a psychiatrist and found that psychiatry was not the best way that he could help people, he ultimately got training to become an allergist immunologist, and he literally said that, you know, everybody's illness in the world is connected to some kind of an allergic or some kind of a reaction to something in their environment, whether it be food or whether it be chemicals. But he kind of made that observation early on in the 1940s, and he really was a pioneer who helped connect environmental elements, including foods, to underlying chronic illness. And he realized that when people eat common foods regularly, they caused acquired unwanted symptoms and illness. And so the more commonly eaten foods or commonly consumed beverages or common exposures, the worse people got. And he taught patients how to avoid intolerant foods to alleviate unwanted symptoms. I'm not sure how to advance this. I don't think I have control over this, so next slide, please.
Sorry about that. Well, there we go.
I'm going in and out of having control, so I don't know why.
Yeah,
there we go.
Yeah, we had an issue on our side that we had to change real quick, so sorry about that.
That's okay. And Daniel, there's a repetitive ringing sound, and I'm not sure if that's normal or not, but like a ring. And is that part of this process?
I think it's normal. I'm not quite sure how to get rid of it. It's part of people logging in and out of the audio.
Oh, got it. Okay, very good.
Yeah.
I apologize. Okay, so the historical perspective some more. Dr. Randolph in 1949, against many of his medical colleagues' viewpoints, unsuccessfully testified at the FDA hearing on bread that all food ingredients should be listed on labels of processed food products. He did not succeed, and it took a lot longer for us to actually see nutritional ingredients on products. It's interesting to me how long ago that was an issue. In 1951, he stated that man's increasing pollution of the environment with chemicals was a major source of illness, and yet still it wasn't really incorporated into the medical dogma and an important aspect of taking care of patients. And he created the approach of investigating environmental causes of a patient's illness, then treating the problem by eliminating them. He was very successful at doing that, as long as the patient went along and did everything he recommended. Dr. Randolph created the Society for Clinical Ecology back in 1965, and it was renamed the American Academy of Environmental Medicine in 1988, and still exists. And I don't know how many members they have, but they have thousands of members nationwide and internationally. And he taught that the more symptoms a patient has, the more likely he or she is to be suffering from an environmentally induced disease. Next slide, please. Oh, there it is. Okay. Thank you. So some common considerations. Usually both the patient and the doctor have not suspected a food allergy or intolerance as the root of their problem, because most of the food allergies or intolerances are a delayed reaction in the body, and they're masked and they're hidden. So when you meet with the patient, like I commonly do, I ask them, do you have any known allergens? And most of the time they'll say no, or they may say, yes, I have hay fever with grass or with ragweed. And I ask them, do you have any intolerance to certain foods? And they say, none that I know of. And so that really doesn't help me as far as determining whether or not they truly have an underlying food intolerance. It just tells me that the patient is not aware that they have anything, and we need to further investigate it. So patients who consume their allergic or intolerant foods regularly often have chronic ongoing symptoms. And therefore, it makes it very difficult to identify what causes what, because they're basically consuming something so regularly that these symptoms pop up all the time, and maybe not so consistently with the food that causes it, because you can have up to a 3 to 4 day delay in having a manifestation of a symptom. Avoiding the problematic food often causes withdrawal symptoms, possibly looking like an acute allergy attack at that time. So people often will consume an offending food on a maintenance basis to avoid these worsening of symptoms. And this is absolutely true, and I learned this in functional medicine as well, that when you try to eliminate a food, the first 5 days are extremely challenging, because you're going to have withdrawal symptoms, you're going to have worsening of symptoms, and then all of a sudden, after about 5 or 6 days of not having that offending food, things start to clear up. But it's during that window period that people oftentimes will consume their repetitive use of foods, and therefore they continually have these ongoing intermittent symptoms. Next slide, please. Okay, if foods are eaten more than every 4 days, they are good candidates for acquiring a food allergy or food intolerance. And my understanding of this, at least all the times that I've reviewed why 4 days is such a golden number, is that it literally takes about 4 days for you to consume a food, to process that food, and to eliminate that food. So that's where that 4 days comes from. It just takes that long to travel through the body. So we'll talk a little bit more about the importance of a rotational diet that is every 4 days later on in the talk. Common foods often cause food allergies and or food intolerances, and these would include such things as cow's milk products, eggs, wheat/gluten products. It doesn't have to be just the wheat grain, but it can be any relative grain that has gluten in it, so barley and rye and spelt, and even oats to some degree if oats are contaminated in a manufacturing plant that uses wheat. And nowadays you can actually see that on the packaging. Soy, corn, yeast, and coffee. So those are common foods that I see in my practice that can cause unwanted intolerances and allergies. And by avoiding these offending foods for a couple of months, people can often reintroduce the food every 4 days without much problem. Next slide, please. And Daniel, if there's any other way that I can do that for you, just let me know. Okay, so sensitivities, not just foods. So foods that cause allergic reactions and or intolerances are often hidden as ingredients in commercial foods. So it's very important, if you're going to start to eliminating a food, that you educate people how to read labels and how to find food products that don't have their offending food as an ingredient. So, you know, as you start looking at ingredients on food packaging, the ones that are higher up on the list are more abundant, and the ones that are lower on the list are less abundant. But I usually encourage people to find products that don't have any of that food in it. So if it's a cow's milk product, they want to stay away from whey and casein, and they want to stay, if they're soy intolerant, they want to stay from any soy product. If they're egg intolerant, egg is oftentimes a common ingredient. So you just have to educate them how to avoid those things. And many modern foods, as well as medicinal drugs, contain preservatives, additives, stabilizers, artificial colorings, and flavorings. So when you're with a patient in the room, you want to talk to them about some over-the-counter supplements, any food products that have added preservatives or additives, any medications that they're currently taking might have some ingredients in there that might actually be allergenic as well. And some scientists believe that increased chemical pollution in our air, in our water, and our food is to blame for a lot of the sensitivities that we have in our world today. And it seems to me that every single patient I speak to in my consultation talks about how more sensitive they're becoming to the world. They would say things like, you know, when I was younger I didn't have any allergy problems, but it seems as I get older I'm becoming more and more sensitive to my environment. And to me, obviously, that definitely indicates that I need to look at that more closely. I oftentimes suspect underlying toxic exposures from chemicals, and that their body just has a certain amount of toxic burden that I'm going to need to work on, and they may be very good candidates for a detoxification program. But along the way, I absolutely talk to them about the process of looking at food allergies and or intolerances to things to see if maybe that's a problem. And then foods can easily become contaminated by the use of insecticides in farming and mold. And molds are also very commonly a contaminant in foods. And I always suspect peanuts, because that happens to be a nut that typically does have mold as a contaminant. But you don't have to wait until a food product has that green fluffy mold on it before it actually has been contaminated with mold. It has it even before then. So lots of foods that we consume have that mold contaminant to it. Next slide, please.
I think you have control now.
I have control. Great.
There you go.
Those little arrows disappear on me, then I don't know what to do.
Yeah, basically what happens if I move my mouse by accident, it defaults to me. If you move yours, it'll go back. So
okay.
You're in good shape.
Thank you. Okay, just a quick review. Immunology from medical school, the gel and COOMBS hypersensitivity classification scale. You've got the type 1 reaction, which is the anaphylactic reaction, where you have on the mast cells these IgE antibodies that are basically sitting there with their little arms open, and they're just waiting for the antigen to sit right on top to cross-link the IgEs. And when they do, they basically cause release of all of these vasoactive substances and amines and mediators and cytokines that basically causes a massive release of these chemicals that really cause anaphylaxis in somebody and could be life-threatening for them. This is extremely rare, but it is a very important pathway of hypersensitivity. You have the type 2, which is a cytotoxic, where you form your IgG and your IgMs. They bind to the antigen. And then that's sitting on the target cell surface, and then they get phagocytosed into the cell to get broken up or lysed by that target cell. And it's an antibody-dependent cellular cytotoxicity, so you need these IgG and IgM antibodies to bring that antigen in so that the cell can go ahead and take care of the process. Type 3 is the immune complex, where you've got these antibodies floating around freely in the blood, and then they bind to the antigen, and you have these antibody-antigen complexes floating around. And then the neutrophils see them, they capture them, and they engulf them in their lysosomes, and then they go ahead and destroy it that way. And then you have the type 4, which is cell-mediated or delayed hypersensitivity, where the thymus-derived T cells are responsible for releasing cytokines, and they cause a T cell-mediated cytotoxicity. And again, this process can happen along a certain cascade of processes, and it can also be a delayed reaction, and that's why it's called the delayed hypersensitivity. Okay. Oh, I think I went too fast. Okay. IgE-mediated food allergies. These usually happen immediately or up to 3 hours after exposure. This is what commonly gets done at the allergist office when they are being administered a test on their backs. They've got these pinpricks, and they watch you for up to about an hour, 2 hours to see if you have any kind of a wheal formation, and then they measure that to determine your reaction. So that would be an IgE-mediated reaction. It happens in less than 5% of the population, and this would be classified as a true food allergy. And to me, I don't think you need to run and tell all these people to run to the allergist to be tested, because you can ask the patient, when you eat a certain food, do you have an immediate reaction to it? And patients will usually tell you this information, especially people who have a peanut allergy, or they have a milk allergy, or they have an egg allergy. They'll say within 30 minutes of eating an offending food, I develop a significant rash on my face, or I notice I have tremendous itching in my mouth, or I notice my tongue swell, or my breathing changes. So I don't feel like I need to really do a full panel of IgE-mediated reaction tests for them, because they usually give me that information, or they already know it when they walk in to see me. And this type of reaction causes symptoms such as hives, diarrhea, stomach cramping, wheezing, tongue swelling, difficulty breathing, and or anaphylaxis. Oh goodness, I'm not sure where that came from. Okay, so the skin tests that you can do for this are intradermal, prick test, or patch test, and it's the reaction of the skin to different substances. The RAS test, which is the most common test that you see at allergist offices, the radioallergosorbent test, is a finger prick, in vitro blood serum testing the amount of IgE antibodies reacting to specific allergens. So this is where they collect a little bit of blood and they send it off and they check it to see if there's any IgE reaction to these exposed antigens, whether it be grass or weeds or inhalants or some kind of a food product. There we go. Okay, delayed hypersensitivity, this would be the IgG-mediated response. This occurs hours, even days after exposure. It affects about 80% of the population. The production of IgG antibodies involving a complex series of reactions which triggers the complement cascade. And there's a release of inflammatory cytokines which leads to the final destruction of whatever got into the system that initiated this by cell lysis. So again, it's like a cascading event, but it's mediated by the IgG antibody. And that's important to know because when you do IgG testing, you are looking for the IgG reaction. And ELISA, or EIA, is a very common way of doing this, and you're looking for the presence of IgG antibodies in patients to these food antigens, and you have all this trays of fluid in there, and you're basically adding to this fluid the antigen. So let's just say it's wheat, or it's gliadin, or it's gluten, or it's casein. You're basically adding them, and you're looking to see if that antigen binds to an IgG antibody that's in there. And if it does, it causes a color change. And the color change can either be a slight color change, which would be a mild reaction, or it could be a deep color change, which would be a very significant reaction. And it will literally be labeled as such when you get your results back. And these patients can usually have this done in the office. They get a pinprick on the finger to get maybe 5 or 6 drops of blood, and you process it here in your office, and then you send it in the mail, and you get the results back a couple weeks later. So this is to see if they have an IgG reaction, allergic reaction to their food, or what we call a delayed reaction to their food. Now, that is very important when you're taking a look at whether or not a food is causing an allergic reaction in somebody. But it doesn't look at whether a person has an intolerance to this food. And this chart is really demonstrating the difference. If they have a specific allergy, it's a specific immunity to that particular food antigen or chemical antigen. They have a genetic exposure possibly. They might have a history of atopy or eczema or asthma in the family, or food allergies in the family. They have an immediate symptom onset at times. It can be IgE mediated through the mast cells and basophils. It could also be the delayed reaction with the IgGs. And then you usually can test for it in the skin test or RAS test, or you can do that ELISA testing for the IgG component that we just talked about. The intolerance is when you consume a food, you activate a whole cascade of inflammation, but it's not through an antibody. It's not through an IgE or an IgG. It's actually through a cascade of white blood cell morphological changes and cytokine release and maybe activation of your complement pathway. And that's what an intolerance may be from. Another reason why the intolerance might happen is because you have such significant gastrointestinal damage that these food particles that are coming down are not being digested properly. They're causing an unwanted reaction in the intestines. The intestinal lining may be damaged, so things are passing through. So if we repaired the intestinal system and the gastric area, these things would probably work fine, but we need to repair that in order to remove some of the intolerance. So delayed symptom onset, often days. You can have innate immunity. You can have this innate immunity is through the T-cell pathway. You can have genetic exposures also. And another thing is it may not be genetic, but it could be an environmental common denominator. So you may have somebody who's been raised in parts of Chicago, which are environmentally very polluted. The south side of Chicago is a common example. That area